Non-steroidal anti-inflammatory drugs, these are used for pain, fever, and inflammation. They are called non-steroidal because they work different from the corticosteroids like prednisone, and they work by blocking the cyclooxygenase enzyme, which will be reducing the prostaglandin levels. Prostaglandins are causing pain, fever, and swelling in the body. How to classify these kind of drugs? By their cyclooxygenase selectivity, we can do it. Why? Because some of the drugs will be blocking the cyclooxygenase 1, some of them will be blocking cyclooxygenase enzyme 2, and some of them will be blocking the both, which are non-selective. That's why we're going to classify them based on their selectivity. So for the first one, which is non-selective cyclooxygenase inhibitors, which is blocking both of the COX-1 and COX-2. But the problem is that when you block the COX-1, you will have gastrointestinal issues such as bleeding, ulcer, gastritis, stomach pain, and we were using H2 blockers like ranitidine, famotidine as a treatment. We were using PPIs as a treatment like omeprazole, pantoprazole. I'm talking about the stomach problems treatment in general. So once you block the COX-1, you're actually blocking the stomach protection because normally COX-1 was protecting the stomach. And when you block the COX-2, you will have cardiovascular problems. You will have problems with your heart. So if you ask me which one is safer, I'm going to be telling you when you block the COX-1, you will have gastrointestinal issues, but when you block the COX-2, you will have cardiovascular issues. And non-selective ones are blocking both of them, so they will cause more and more side effects that you can't even imagine. Yeah, non-selective COX inhibitors, which is blocking both COX-1 and COX-2, such as aspirin. Aspirin is the only one in the non-steroidal anti-inflammatory drugs which is irreversibly blocking COX-1 and also COX-2. And aspirin is the antiplatelet here, and aspirin should not be taken if you are under 13 years old. Some teenagers, some kids are using it and it is wrong. If your doctor says you can use it because you have heart conditions, yeah, you're going to use it, but normally you cannot use it. Why? Because there is a condition called Rey syndrome. Once some teenagers use it, their liver stops from working and their brain swells. It's very dangerous, especially if they have a viral infection like flu or chickenpox. It's very dangerous. That's why we should be careful with it. And also we should be careful with the aspirin overdose. If they ask you what are we doing in aspirin overdose, you're going to say we're going to give sodium bicarbonate or we're going to do urine alkalization. It's very dangerous. We will see tinnitus, we will see respiratory acidosis in the aspirin overdose. That's why. About the aspirin, it's enough for now. And then there is ibuprofen in the non-selective ones. You can use it for short term. Naproxen is more for long term, such as in arthritis, we use naproxen. And diclofenac, indomethacin. I don't know if I'm pronouncing them right. You can change them based on your country. And another drug group is preferential COX-2 inhibitors, which is mainly blocking COX-2 and a little bit of COX-1. Meloxicam, I don't know how to pronounce. Selective COX-2 inhibitors, celecoxib, etoresoxib. Be careful with the celecoxib here because professors like to ask which one is COX-2 selective. You're going to say celecoxib. Or they can ask you what is celecoxib and you're going to be explaining them. Alright, so mechanism of action. They inhibit cyclooxygenase enzymes such as COX-1, COX-2. COX enzymes, cyclooxygenase enzymes, convert arachidonic acid like prostaglandins, thromboxanes. Also, aspirin is lowering the thromboxane A2. That's why. When they block COX prostaglandins, when they block COX, prostaglandins levels lower. And we said about the aspirin. All right, so what is the difference between COX-1 and COX-2? COX-1 is always active, protecting the stomach. COX-2 is induced during inflammation, less side effects, but more cardiovascular problems. Non-selective blocks both of them, so more side effects. What about the pharmacologic actions happening in the non-steroidal anti-inflammatory drugs? You're going to say these are anti-inflammatory. These are antipyretic to reduce the fever. These are analgesic for pain relief. Aspirin is antiplatelet. And like I said, aspirin can be used during the heart disease prevention. So I said, yeah, under the 13 cannot use it, some teenagers, but if doctor says there's a heart condition going on, you must use it, then you're gonna use it. But normally, no, we said, all right. Because of clotting, they use it. And what are the adverse drug reactions here? Gastrointestinal problems, we said, renal failure, edema, hypertension, cardiovascular due to blocking COX-2, hematological problems because of aspirin, which is increasing the bleeding. And so, what should not, what we shouldn't use the non-steroidal anti-inflammatory drugs with? What kind of drugs we should not combine with them? Anticoagulants such as warfarin, heparin, because there is bleeding risk. And also, you should not take alcohol with non-steroidal anti-inflammatory drugs. I mean, you should not take alcohol in any type of drug because drug is actually playing with. Alcohol is playing with drug levels. It can increase the toxicity. It can increase the drug effect. So never take alcohol. But in non-steroidal anti-inflammatory drugs, again, don't take anticoagulants, don't take alcohol, corticosteroids, ACE inhibitors, beta blockers, and methotrexate, which is increasing the toxicity. We also talked about aspirin overdose. In aspirin overdose, we see tinnitus, I said, metabolic acidosis, shock, coma, nausea, vomiting. And so, pregnant cannot use non-steroidal anti-inflammatory drugs, especially if they're in their third trimester. Babies cannot use it. Children cannot. So, what are they going to use? They're going to use paracetamol. I'm talking about sensitive topic because pregnant ladies and babies. So, of course, you should be talking with your doctor first. But yeah, paracetamol is not a non-steroidal anti-inflammatory drug, but we use paracetamol in these kind of situations. If your professor asks you, what do we use? You're going to say paracetamol. But why is paracetamol not non-steroidal anti-inflammatory drug if we can use it? Because it does not have anti-inflammatory effect, but it is analgesic and antipyretic. Analgesic for pain, antipyretic for fever, reducing the fever, we said. Always give, this is a note, always give non-steroidal anti-inflammatory drugs with food to reduce stomach irritation. We talked about COX-2, aspirin overdose. These are the drugs in general. We already classified them, but yeah, indomethacin is non-selective, ibuprofen, non-selective, naproxen, non-selective, like these are the same things. If they ask you which ones are anti-anginal, sorry, ibuprofen, paracetamol. Antipyretic ones are ibuprofen, paracetamol, aspirin. Paracetamol is not non-steroidal anti-inflammatory drugs, but if they ask you like that, you're going to say it. Yeah, that's it. I talk very fast in order to not to make the video long. That's why.